Welcome to the Academy of General Dentistry podcast series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Hey, welcome back, everyone. We've got another fantastic show for you today as we welcome our guest, Dr. John Molinari. And he's been one of the most highly listened to guests we've had on the podcast, and we're really excited to have him back and look forward to chatting with him for the next 30 minutes. But before we begin, make sure you subscribe to our channel, hit the like button and ring that bell. That way you'll be among the first to be notified of all things AGD. So as I said, my guest is Dr. John Molinari. John, how are you?
I'm fine, thank you. How are you, sir?
I'm doing very well. And again, thanks so much for coming on the podcast. We really appreciate that. And yeah, so I just want to go ahead and give a quick bio for Dr. Molinari. Dr. John Molinari is a professor emeritus at the University of Detroit Mercy School of Dentistry, where he served for 32 years as chair of the Department of Biomedical Sciences and director of infection control. Later, he was director of infection control for the Dental Advisor, where his laboratory was involved in research on emerging infection control technologies and products. He has authored over 600 publications. He was a consultant for the Centers for Disease Control and Prevention, American Dental Association, and regional hospitals, and continues to lecture on topics dealing with infectious diseases and infection control. And as I mentioned, Dr. Molinari has been one of our highest rated guests. So again, such a pleasure to have you back on the podcast, and really look forward to our chat over the next 30 minutes or so. So, infection control, obviously, it's at the heart of what we do as dentists, right? It's something that's so very important. And sometimes, I don't want to say we take it for granted, but there's so many other things happen in the dental office. And there's a lot of regulations that change over the years. And I'm not sure that all of our listeners are quite up to date. So maybe we could start off, just tell us what's, some of the latest updates, some of the things that we really need to know about as we practice in our office every day.
Well, as an introduction, first, I want to congratulate you and dentistry on what you have accomplished in infection control. I was a graduate student in 1965 at the University of Pittsburgh in the School of Dental Medicine. And one of the things that I've been at, of course, in dental schools, I've seen the evolution of infection control in dentistry. And I have to say, you all responded to all the challenges. You developed the appropriate protocols. You have responded to vaccinations against hepatitis B. As far as updates on regulations and things, with COVID, we've seen a lot more interest in respiratory exposures and airborne challenges, not just microbial, but particulate, like with dental dust and grinding. And so the respiratory precautions have gotten much more stringent over the years. During COVID, dentistry responded. N95 respirators, the fact that you had the extra ventilation systems in your operatories to filter out particulates and microbial pathogens. Those are really the big updates right now as far as infection control. Obviously, sterilization, disinfection, water lines, PPE, those have been there. But with COVID, that really emphasized a lot more of the research and necessity for airborne precautions in healthcare settings. Certainly hospitals where they had problems with COVID. Dentistry responded to those challenges as well.
Yeah, and you were one of our great contributors during that period. Of course, AGD put on a lot of really wonderful information for all of our membership, and you were a part of that. So again, thank you for that. And so you bring up an interesting topic. So I wanted to ask you about COVID, because as you said, dentistry, at least in my opinion, over the years, all the years that I've been here, we're always very keen on PPE. When you're in school, you're trained on that. I came in, years back, of course, folks didn't wear gloves and all that. I came in a little bit after that. But we've always been really, really, in tune with that. And we were always taught, to treat every patient as if they were infected or had some kind of disease. And we always use those precautions. So why did it take COVID for us to focus in so much on aerosol, given the fact that we, almost everything we do is aerosol, when we have cavitrons, when we have, air water syringe and all that. So what happened there?
Well, first of all, COVID was such a horrible, unusual event. Uh, Also, dentistry had never been asked to treat any patient with an airborne disease ever. If you had somebody suspected of tuberculosis, you deferred care and referred for diagnosis. If you had someone suspected of an airborne infection like measles, again, you deferred care, you refer for a diagnosis. COVID was really the first aerosol mediated disease where you could have patients coming in that were asymptomatic or mildly symptomatic, where you didn't really notice, but yet they were shedding concentrations of the virus, especially with the new subvariants, the XFG and some of the later ones that have come out, the Omicron subvariants. And so dentistry was asked now to take care, to take virtually the same precautions that we saw in the hospitals when they were treating active COVID patients, because you were seeing them at an earlier stage. And again, you responded.
So what are some of the things? So just I'm going to take a step back and reflect back over during that time. I know a lot of folks were using N95 when they couldn't get it, K90, KN95, and all those different things. And there was different, PAPRs and
Mm,
various suction devices and all that. But over the last couple of years, I've seen that go and dwindle away and to back to where, I don't want to say where we were pre-COVID, but a lot of that stuff has gone by the wayside. Now, do you think that's a function of just operator fatigue, or is this that we become more, I don't want to say immune to the virus, or talk to me about that a little bit?
you bring up a great point. Uh, I think a lot of it's COVID fatigue. I think people are COVIDed out. The virus, COVID's not gone. The new variants have shorter incubation periods. If you've been immunized or have recovered from previous infection, what a lot of people have done, you have some temporary immunity. So the infection may not be as great or as severe in those people requiring hospitalization, but COVID is not gone. My feeling, and I probably get in trouble for this, is I like the fact that not only did you all respond with N95s, but I think you should continue it. You have so many aerosol generating procedures, and COVID is not going to be the last thing that we see. Plus, you have the particulate material, as you said, the grinding, the dental lab stuff. All those particulates have been shown over the years in dental lab techs and dentists to cause pneumoconiasis, idiopathic pulmonary fibrosis. The research on this is becoming more extensive. And so I get in trouble in my courses when I say, I think it's a great idea. You already did N95s to continue. I know people aren't. At the very least, what I suggest then is to use an ASTM level 3 tight-fitting surgical mask. You have the cinches on the bottom and you got it tight to the face. That is an alternative. Not as good as an N95, but it's better than the level 1s or level 2s or the masks that are open on the side. So that's my fault. I figure you've already adapted to N95s, but I know then people have backed off. And then I asked people, I said, okay, are you stopping wearing gloves because you got vaccinated against hepatitis B? Well, they go, of course not. I said, well, you responded with the aerosols with the N95s, but there is an alternative.
So let me ask you this while we're talking about N95s, because I remember during COVID, I was teaching at NYU. And when we were at NYU, we had to be form fitted for an N95 and prescribed,
Yes.
if you would, a certain type, because there's more than one type of N95. And I feel that a lot of folks at the time and even now are buying these things on Amazon and all these kind of things. So talk to me a little bit about getting a properly fitting N95 and where could someone go to get fitted for an N95 post-COVID? How does that work?
Well, you look at 3M, for example, they've always been very, very good. You look at what used to be Kimberly-Clark, had great N95s. And I can't think of some other ones. The thing is, you have to be careful with these knockoffs because yes, it's true about the being fitted, The government has eased up on those regulations about fit testing because some people have difficulty breathing with them. And so
Yeah.
there have been some modifications in those recommendations. But you can find some good, not expensive N95s that work. And that will do the job. I can't give you other products than the one I just gave you, but it's something that I was so pleased to see dentistry respond the way they did. My dentist down here where I am in Central Coast, California, is a small practice. He was doing all the right things right away. You know, he just responded, and he had been in practice for, like you, about 25 years or so. And he said, nope, this is the way we're going to do it. This is the way we should do it. And the patients really appreciated it on top of everything else because the patients saw firsthand what they were doing.
Yeah, I'm really proud of the dentistry's response. There's no question about that. I
Yeah,
don't know what the statistics are. You may know the statistics, but among infection or fatalities among dental providers, dental hygienists, and all that, I don't know what it is, but my guess is it's not very high, given the fact that we were exposed to so many pathogens, if you would.
sure. I don't know the statistics, but I can tell you that I am not aware of any major outbreak of COVID that was traced back to a dental office, to a dental practice. I'm not aware of it, and I could be wrong, but I just didn't see it.
Yeah, yeah, yeah. So we talked about the big bad monster COVID, but I know, and you have a great course on this, and we'll talk a little bit later on how folks can reach out if they want you to come and speak. But I know you talk about emerging and re-emerging infections. So talk to me a little bit about some of these things that are lurking that we might not be thinking of.
Well, one that is people are starting to think about, uh, not a risk for dentistry, okay, is bird flu. And this is something that I'm a nut. I'm a microbiologist. I've been following this since it first started in 1996 out of China. And early on was pretty aggressive. It hasn't gone human to human, but the fact that this virus is very adaptable in birds, now poultry, cattle, mammals, and it has been passed to humans in certain circumstances, shows that this thing has continued to evolve. And this is one that they're trying to track. Unfortunately, some of the numbers of people being able to track this has declined, but that's a potential problem down the road. If you look at something that's more immediate to me and for you as dental professionals, it's hepatitis C.
Mm.
Seeing an estimated significant increase in hepatitis C cases. Uh, and that's a problem. We can say drugs, drug abuse, because it's a perennial disease. It's not really a sexually transmitted disease. Uh, and that's probably more of the problem here. One of the things is it's a silent killer. The person may have some symptoms within a couple of weeks, but then if they don't recover on their own, the virus goes and basically asymptomatically can destroy liver cells over the next 10, 20 years. And so we see an increase in cirrhosis, liver cancer, liver transplants, things like this. And the rise of hepatitis C is increasing. And that's a concern. The good news for you as a dentist is that your standard precautions, as far as bloodborne diseases, protect against hepatitis B virus. And hepatitis B virus is far more infectious than hepatitis C virus. So by protecting yourself against B, you protect yourself against C, and that's good. But again, you have to be compliant with those standard precautions. But as a public health issue, hepatitis C is, in my opinion, an issue, certainly for the population, certainly for the public health. We don't have a vaccine for it as yet. They don't have a good antigen for that. So at this point, you have to use your preventive measures for that.
Yeah, and as you said, fortunately, as you said, everything we're already doing seems to be on board. What about measles? I've been hearing a lot about measles lately.
Measles is, in my opinion, exploding, not just in the United States, but Canada, Mexico. Europe. Part of it, a major part of it, is a significant decline in vaccination of young children. There seems to be more and more of that happening due to a variety of reasons. These vaccines have worked. I've lived long enough, and so have you, to see how successful these vaccines have been. And I think that's being threatened right now. And we need to do what we can to get people to realize that the historical significance of these is huge. And as these diseases come back, they can have varying degrees of transmission, but they can also have secondary effects, which can create major problems health-wise, especially for young children.
Yeah.
And that is something that we haven't been able to address in the last couple of years.
Yeah. Absolutely. So let me ask you one more question, then we have to take a quick break here. So we're talking about diseases here. So when I started practicing dentistry, HIV was the big hot topic, hot button, if you would. And obviously
Oh, sure.
a tremendous problem and killed so many people, unfortunately. Nowadays there's treatment for that. Do you see where folks are starting to get a little, HIV fatigue, if you would, like COVID, where people are getting a little bit more lax and we have to be more vigilant about this in the office and otherwise? Or what's your feelings on that kind of situation going on?
Fortunately, HIV is even less transmissible with blood in dentistry and stuff like that than hepatitis C. So again, using the standard precautions with hepatitis B as your marker, HIV is in that group. So that's protected. The fact that we have better treatments where the viral concentrations can be dropped dramatically with routine medical prescriptions and stuff like that has helped. I don't know if people have becoming less and less aware of HIV. I think it's more the fact that other things are taking their place in people's minds, and there's only so much that people can have on their minds.
Yeah.
COVID just really shocked everybody and took away from everything. But HIV, of course, is still out there. People are being treated, but then there are people not being treated. But oftentimes they'll have symptoms. And again, the dentist would recognize at least some symptomatology. Again, defer care, refer for medical evaluation.
Yeah. Yeah. Thanks for that. Dr. Molinari, we have to take a quick break. We'll be
Sure.
right back. This AGD podcast series is sponsored by DHP, one of the largest family-owned full-service dental dealers in the United States. DHP provides dental and medical supplies, equipment repair and maintenance, technology, and equipment sales. AGD members receive exclusive discounts and promotional offers when you buy from DHP. We are especially grateful for DHP's continued support of AGD. Their partnership helps make this podcast and these vital conversations possible. Discover why like-minded general dentists work with DHP by visiting their website at dhpsupply.com. Hey, welcome back, everyone. We're talking with Dr. John Molinari here on the program, and we're talking about infection control. But before we get to that, I want to remind you that Dr. Molinari is going to be speaking at AGD 2026 at Caesars Palace in Las Vegas, Nevada, June 24th through the 27th. And we have an amazing program for you. And one thing I want to mention that early bird registration is going on now, and that ends on April 30th. And why is that important? That's important because if you register early, you're entitled to a free course by Dr. David Hornbrook. And so you don't want to miss that. You want to make sure that you register early. And Dr. Molinari, you're also going to be at AGD 2026. So tell
Yes.
me a little bit about your courses and what you're going to be telling us about out there.
It's an infection control update. So I'll be talking a little bit about some of the things that we've talked about the first part of this discussion. I'll talk about some of the challenges, bloodborne. I'll also talk about some of the particular challenges from the grinding, the first seen in dental lab techs in the 80s and 90s, and that have been more research as far as long-term occupational risks for dentists and dental lab techs. And then, of course, go through infection control. Small section on vaccine challenges. But of course, the classic infection control updates and sterilization, disinfection monitoring, water lines, uh, PPE. One of the things that is interesting, and I think COVID brought this out, was that more and more people are using face shields in addition to the masks to protect the mask, the N95s, the eyewear. You didn't really see that as much before COVID, but now I think so many more people are using face shields. And so we'll talk about some of those trends, talk about sharps exposures, accidents. Uh, it's a 4-hour course with a break. So I have to cover an awful lot of material in a relatively short period of time, but we'll do it.
That's good. I'm sure you're going to do an amazing job of getting all that great information in
Thank
there
you.
because it really is good stuff and it's important. And you know what, you brought up an interesting thing too, because when we think about this and when I think of you, I think of, infection control and talking all about all that. But I think a lot of people don't think about all the particulates that we breathe in, not using a mask and things like that when we're doing lab work and the dust and all that. And that's a real problem. I mean, and
It
I'm at the,
is.
especially even at the dental school where I teach, you just get lazy, but you're in a rush. You might not be wearing a mask and you're trimming it temporary and there's dust and all that. That's a big problem, right?
It is. And, it was something that everybody knew that you all generated these types of materials and dusts and fumes, especially even now with lasers. Um, but for so many years, it was not considered to be an occupational hazard. Other industries, textiles, manufacturing industries, where they were doing a lot of grinding, you saw them wearing respirators and they were having problems before them. It took like till the early 80s until some of the early studies on dentistry came out, and they were doing lab tech studies. And that's where they really got introduced to the long-term hazards that of these things going deep into the lungs and causing really severe lung problems in the 50s, 60s, and 70s when they were, at that age group. So it's something that I'm going to be bringing up because I think, as you just mentioned, people don't think about that. They think infection control, they think biological, but there's other things out there. And now with more practices using lasers, these things are really fine particulate materials that can go deep into the lungs if you don't have the right respiratory protection.
Yeah, and just like anything else, a lot of folks, especially when you're coming out of dental school, you're young, you kind of think you're invincible, you're not thinking about that, you're healthy. It
Exactly.
isn't until, as you and I know, right, 40 years later when things started to, give you trouble, and you really got to be
Yep.
mindful of that.
Yep.
So we
Good point.
try to, yeah, we try to counsel the kids on that. You also just mentioned a minute ago water lines, and that's another thing that I think people take for granted is water lines. So give us some best practices when it comes to water lines. I know a lot of people use the bottles, but a lot of people
Right.
still use city water or well water, whatever the case may be. So talk to me a little bit about that.
The the separate bottles have been a lifesaver, I think. And you and I can both remember where the units didn't have them, and then you'd have to retrofit the units and all that stuff.
Yeah.
Basically, uh, the separate bottles are great. Making sure that you change the water at least daily, change the bottles at least daily, depending on the use of the practice of the unit, maybe more than once. Uh, but also rinse that bottle out very well. And then at the end of the day, after you've flushed the lines as best you can to remove all the water that you can possibly remove, because there's still something in there, put the empty bottle back on at the end of the day after you've cleaned it out. The reason is, and we saw this in the school, you probably saw the same thing. Dental students would take the bottle off, drain everything, and then put the bottle on the counter. And then next day, a student would come in, not realize the bottle wasn't on, and turning it on. And now they're sucking stuff up from the air into the water
Mm,
lines, which can colonize it. So make
yeah.
sure you put the bottle there. The other thing is check with the manufacturer of the unit to see what type of water goes in that bottle. And I'm going to mention something here. I hope I'm not stepping out of bounds, but I was at the California meeting last year and I talked with ADEC, and ADEC doesn't recommend, I believe, distilled water for their units. Distilled water is so pure that it can remove ions from the metal fittings, the blocks in the lines. And they
Wow.
recommend tap water. Now, those of you that are listening, please check with your ADAC rec to make sure that I'm giving you the right information. But they have these reverse osmosis units, that manufacture, that have the cartridges. You've seen those.
Mm-hmm.
Those things produce a water which is very, very good, and it is compatible with the water line fittings and stuff like that. So the type of water is important that you put in the bottle.
Yeah.
Obviously, for surgical procedures, sterile water, sterile saline, that's obviously a given. But as you go more and more into this, it all comes down to asking the right questions and then compliance with the recommendations.
Yeah, there's no question. If you think about it, you'd think, okay, you're doing the right thing, but it makes sense by using distilled water and things like that. But it makes sense to me that water goes through and it would leach out or pull things off from the
Yeah.
whatever might be in there. What about I know I'm not a dental, tech guy in any way, shape, or form, but I know there are some of these cartridges that go in the J box where the water filters through that. Is that from the city line? I mean, that's another thing that we could use,
I
I'm
think
thinking.
that's from the city line. I think that's from the city line. But again, if you have a boil water notice, in your community, you can't use that. You can't use the city water, and
Yeah.
so you have to do something else. And that's where the separate bottles really come in very nicely.
Yeah, I know you're gonna cover almost everything that we talked about more in depth in your program, and I'm looking forward to coming out to see that in
Thank you.
Vegas. Last thing I want to talk to you about, and I know you speak about this as well, is what we have a lot of patients that are sick or they're immune compromised, and any things we should be thinking about that, any extra special precautions that wouldn't come to my mind that I need to be doing as a practitioner. How are we
Well,
treating these folks?
one of the things is the water. Uh, you and I, we have competent immune systems, okay? We've been exposed to airborne microorganisms and water most of our lives. Think back when you had the first window air conditioning units and how great that was. But after a while, that air sort of smelled. That's because of the biofilms that were forming on the plates where the water was going over. Now, you and I, our immune system controls those. Those are normal organisms. As you see more and more immune compromised patients living longer, thank God,
Hmm.
their immune systems can't handle all the things that an immune competent person handles. So in the area of water, for example, it's I don't want to say it's even more important because it's important all the board across the board, but it's important that the water is potable at the very least, and clean because their immune systems have problems. And we've seen issues in medicine in particular. We've had a couple of outbreaks in dentistry. Um, Not as many, thank God, that have been reported, but we're seeing more and more immune compromised patients in the practices as we are in the population. And the fact that they don't tolerate exposure to these airborne organisms like we do is all part and parcel of your standard precautions.
Yeah, no doubt about it. And again, I keep saying it, but I know you're going to go into more in depth
I will. I
with your
will.
courses there. So let me ask you if folks had a question for you, or if they want to invite you to come out and speak and make you a part of their local community, how can we get a hold of you?
Uh, I'll give you my Gmail is my name, JohnMolinari, PhD @gmail.com.
Fantastic. And like I said, I wish we had more time to talk about this, but we're going to see you out in Vegas, and we'll have you back on the program, of course, to give us some periodic updates on infection control.
Thank you.
Yeah, I can't thank you enough for coming on the program. Thank you.
My pleasure, George. Take care. Thank you.
Absolutely. Yep. And I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on Spotify, the AGD app, SoundCloud, Apple Podcasts, and of course, YouTube under @General Dentistry. If you have any questions, concerns, or comments, please contact us at news@agd.org. Thanks again, and we'll see you next time.